So this is a difficult topic, and I will explain why, because there is some misconceptions about medical tourism. Most of the time, when you hear about medical tourism, you see only one side of the conversation. So medical tourism, or health tourism in this case, is people who travel from one place to another one. But not only countries, but cities or state, usually is for the purpose of obtaining any type of treatment away from where they live. Usually, and this is the misconception, that people only travel to less developed countries to find a better price. Even some of the insurance in our country, they send their patients for cardiac surgery to India, for example, or they send it to other places to save money. It doesn't mean the quality is bad. But when you take a look, this is happening all over the world. Probably you heard about hair transplants in Turkey. You heard about bariatric surgery, Mexico, plastic surgery in Colombia, Brazil. So you're going to hear it. And this is the one more related to prices. And this is where you get sometimes complications that you got outside. People come to our country back, and then you hear about the crappiest complications ever. So that's part of the misconception. But the number one country who receive medical tourism in the world is the United States of America. And you are in the city that probably has the biggest medical tourism in the US, that is the Cleveland Clinic, for example. So 0.5% of all the air travelers, this doesn't include the border from Canada or Mexico. So more than 200,000 people least health treatment when they come to the US. And that's not includes the one that come by car. And it doesn't include all those who doesn't list that one, because most of the people I know, most of the patients we receive here, they come as tourism. They come as a tourist. They don't want to mention that they come for health issues. So data from the Patient Beyond Borders tell us that more than $60 billion yearly industry. So this is a huge industry. So you guys need to decide if you're going to take advantage of the medical tourism, not only for primaries, but people who had surgery outside the US and now come back and they either need a revision, manage a complication, or something else. But to be honest, it's a cost-saving solution for many people that cannot afford to have it in their countries, but also some patients want to come here because either they don't have the treatment where they live or they're looking for some specific treatment. And there is this publication that you need to go and look, because medical tourism inside the US is possible. There are people now traveling from states to states for looking for better price, for looking for a specific treatment that they don't have it in their places. But look at this comment that came from the president of the California chapter of the American College of Surgeons when they were asked about medical tourism, and they said that one of the reasons we have problem with medical tourism in the US is because there is lack of price transparency in America. So patients, sometimes they don't understand what charges, what amount they're gonna get when they come to our country. So when you look at this, for example, domestic travel, that is still medical tourism, is on the rise inside the US. So it's thanks to the internet, of course, social media, and they having a big impact in the healthcare system. For example, and I found this example now that we are here, 2010, Lowe's Corporation entered in an agreement with the Cleveland Clinic to give its 40,000 employees the chance to come here, be coverage, their dependents. It doesn't matter where they live. So that's happening, and this is in the rise. So why do we need to add this, either more tools or more patients? Because now that we treat a lot of complications, even the patients who went outside, when we treat and we need to do some revision to those patients, then you need to decide if you only want to do primaries, metabolic procedures, because those patients already had it outside, or you are willing to take those patients. And I see a lot of people, a lot of surgeons in the US, we don't take, I do, but we don't take patients if they had the surgery outside, because we don't have to have anything to do with that. I think that's a mistake. And that probably will be my best message for us today, because we can take some advantage about it. We need to be more smart about what to do with those patients. Why we reject them? Because they have surgery somewhere else? Because they went first to look for better price, or a friend had the surgery there and they thought it was safe? So when you look at the numbers, and I have up to 2022, and one of the things that has been increasing is revisions, this is a big opportunity for our practices. So not only primaries, revision, and now that endoscopic revisions can be done, even primaries and endoscopy, plus the use of medications, you need to decide if you're going to follow these patients, but not only you need to make sure that your multidisciplinary group, if they are part of your practices, they can take this patient, they can follow them, because most of the countries where they travel, there is no follow-up at all. So you can take advantage of that too, bring them to you, as long as these procedures, these new tools, this revision are supported for our societies, and we're going to have a better menu. Bring your patients from medical tourism, even if they have the surgery, for your multidisciplinary group, because that's what they need now, and you give work for them. So practice who do all, probably will find a better individual approach to all the issues in our patients. And now that we move from surgical-based practices to obesity practices, then look at all the opportunities this patient that had surgery outside they're going to have. So to finish, can you mention the difference between this and this? If you cannot, then don't accept the medical tourism patient that have outside. But if you can, you need to understand that there is medical tourism and there is medical tourism, and our practices can take advantage of that. Thank you very much.